corporate employee health and mental well-being in the reboot era of COVID-19. We hope you enjoyed this session. Just to take you through a couple of things before we start. If you look down at the options below, you will see the mute option. Please, we would request you to keep yourself muted at all times and to use the chat option as much as you want to. If you have any questions during the session, please feel free to type a message there and address any of our speakers. We would like to also ask you to put your name and company name as well so we know who you are. Thank you so much for that. Right now, I'll just be introducing our moderator for this session, Mr. Nandan Bhatia, who's been a senior consultant with AROGYA'S since January this year. Prior to this, he was the head of administration and facilities of Britannia Industries for a decade and has got 11 years of operation and sales stint in IT and hospitality sectors like HCL Technologies, Lea Palace, ITC Windsor Hotel. He's been instrumental in operating and developing facilities with maximum efficiency, safety, employee comfort, and effective client relationship. He also serves as a governing council member on Infra and GACS. Nandan, would you like to take this discussion forward?
And thank you very much, Hema, for the introduction. And it's great honor to be presenting this webinar along with CII. And I would like to take this opportunity to welcome all the participants who are representing CII companies, CII members of Apollo, Jubilant, Fundermax, Volvo, and our corporate association partner, GACS and Infra. And thank you very much for today joining for a very important subject, which is of corporate employee health and mental well-being in the reboot era of COVID-19. Just to set the context, today's webinar, we will be talking about some important and critical objectives, which is going to be very meaningful for all our participants. We will be discussing about the journey of Arogya World India Trust in the country in terms of prevention of chronic diseases, especially at the workplaces. We're going to introduce the concept of holistic health management to companies who are participant to be more proactive towards employee health and mental well-being, which is the need of an hour. Today's topic will also guide companies which has come up with a successful employee health and wellness strategy as very part of the important strategy. Ensuring the employee engagement, which is again very, very important, boosting workforce effectiveness, shifting the culture and mindset of the organization towards a healthier path. We will be touching upon that, and some of our corporates who have taken a lot of great initiatives, we will be talking about some of those initiatives also. AROGYA'S has got unique tools and programs which offer to the health companies advance well in their journey towards employee health and wellness, and we'll be touching upon that also for your understanding. We're going to capitalize on new possibilities and opportunities to fundamentally transform the workplace towards health and wellness, which is critical, and we are going to talk about that through our eminent panel speakers. And I'm glad that today's session we have a leadership team of Arogya World India Trust, as well as we have the corporate leaders and the hospital leader from NIMHANS, who will be sharing their thought process and best practices as a thought leader. I would like to first introduce Usha Chander, who is the head Healthy Workplace Program at Arogya World India Trust, Bangalore. She has been in Arogya World from November 2015 as a senior consultant, and she's been earlier worked as a consultant in quality assurance in higher education and assurance of learning program in universities in South Asia. She's also a former member of International Network for Quality Agencies in Higher Education. In fact, Usha, during her tenure, was a faculty at an Asian Institute of Management, Manila in Philippines. Welcome, Usha. We have eminent speaker, senior speaker from Arogya World, Dr. Geeta, who is a PhD in economics from Bombay University. She is a quality expert from last 25 years and currently associated in Arogya World as a senior consultant and a thought leader in Arogya. Uh, Ashwini, who is again playing an important role in Arogya world as a senior healthcare professional and currently as a regional director associated with Arogya. She has around 23 years experience in preventive healthcare management, and she comes from a corporate as a lead background of J&J, Apollo Health, Cadbury, and Thyrocare. Welcome, Ashwini. Our eminent speaker, Dr. Poornima, who is as an additional professor at the Department of Clinical Psychology in NIMHANS, Bangalore, and she's a psychotherapist, trainer, and a researcher with various interests. In fact, she has been involved in workplace mental health initiatives for corporates, including workshop series, awareness programs, and research on employees' stress and well-being. So I'm sure that it will be a great session from Dr. Poornima, where she will be sharing the thought process again. Uh, Welcome, Dr. Poornima. Dr. Kowshik, who represents our Healthy Workplace and the Chief Medical Officer of Toyota Kirloskar, which is an automobile manufacturing company and is responsible for providing functional leadership and maintain employee health by managing occupational health, wellness programs, and services to achieve optimum health of employees and improve and enhancing the productivity. In fact, he is a subject matter expert on occupational health with around 20 years of experience, worked with International SOS, IBM, and MCF Limited in various capacities and rendered services to corporates of India, Australia, and Middle East. So Dr. Kowshik, thank you very much for joining us. And I would like to again, glad that all the eminent speakers are there in our program. And I'm sure it will be a very enriching session, what has been scheduled today. Allow me a minute and I will share the presentation slide with you so that we can continue the session now. Oh, great. I hope you are able to view the presentation. Wonderful. Thank you very much. So we have framed this session for around 120 minutes, in which we will be talking about the convergence of AROGYA'S Healthy Workplaces program with the corporates, and how we can make corporates benefit to adopt the best practices on majorly on employee health and wellness. And we will be talking then to Dr. Poornima in terms of sharing the best practices from the NIMHANS as a thought leader. And then the Dr. Kowshik, who will be talking about the best practices from Toyota Kirloskar. So as you are aware, COVID-19 pandemics in terms of healthy workplaces and employee well-being, which is has a rapid outbreak of the coronavirus in terms of alarming health crisis, which entire world is grappling with. And it's not only impacting the human health, but it's also significantly hitting on the commercial impact, which is being felt globally. The COVID-19 pandemic currently has put the spotlight straight on how the corporate's environment, how it is impacting our lives, and wellness is no longer a good to have feature. It is must have fundamental, which is very, very important to address. And that's how we have framed our program today. In fact, the Indian companies are advising employees to adopt simple health measures during this prolonged lockdown to be physically and mental upbeat. And I think that's very critical, where you have to be mentally and healthy. Health is very critical to manage this current crisis. So as the study says, that epidemic don't last long, but the learnings from the epidemics will last very long. And that's what we are going to address today. A very senior professor from WHO, Evelyn Cottom, she says that it is unethical and short-sighted business practice to compromise the health of workers for the wealth of enterprises. And that's what the entire theme of AROGYA'S webinar is all about. I'm glad that we have been conducting a series of the webinar, and today is our 7th webinar in association with CII. And what we have listened and what we have gathered the information from some of the thought leaders from the corporates and the best practices, what they have adopted. And I would like to quickly give a snapshot about that, how corporate can prepare during this pandemic like COVID-19. So I feel that it's very important that employees, that the leadership team of the corporate should encourage employees to build their strong immunity system, which will prevent illness and making employees to stay productive. I think the other point, which is very critical, is to promote healthy habits, which will drive eat right concept and implementing the right measures and lead by example to make sure that the workforce is best set up to tackle any kind of illness or diseases. I think what's very important is the healthy eating, doing the physical exercise, and so on and so forth. In fact, the another aspect which corporates are focusing on more on their employees is to manage the mental health, which is again important and needs to be very much focused in current scenario, ensuring that they minimize stress and burnout by running mindfulness and meditation session. The relaxing activities I feel is again very critical and important to execute in terms of ensuring that people are managing their work-life balance, shutting down their laptops on their work when they are working from the home in a prolonged manner, and ensure they are having bedtime routines and so on and so forth. From the perspective of Arogya World, we bring a lot of programs on the health and wellness of the corporate perspective. And just to give you the brief about the organization, and we are proud that we are associated with Arogya World, which is working towards in India, which is working towards prevention of the prevention of the non-communicable diseases through health education and lifestyle change. And the overall mission of the Arogya World is to change the course of chronic disease in the country through a very strong strategy of focusing on partnership and innovative technology by implementing scalable and sustainable programs with measurable impact. In fact, some of the programs which we have been conducting with our healthy workplaces, and we are glad that we are around having 131 companies in the country who have associated with Arogya, and we are touching the lives of around more than 3 million employees from the corporate sector. And well, we are majorly focusing on to provide the solution to our healthy workplaces that they can better manage COVID-19 and prevent the other chronic diseases through employee health and wellness programs. In fact, health policy is very important and must for an organization, which we will be talking about. And if existing, it should be revisited to ensure that it is being appropriate for the present situation. So overall, if you see the innovative approach, what Arogya brings is to leverage the workplaces as a platform where the maximum Indians spend the more time at the workplace. So Arogya World has come up around 10 years back. In fact, we have completed a decade in March 2020, and being playing a role of strategic partner and providing evidence-based, data-driven and outcome-oriented solution towards employee health and well-being, which is helping organization to enhance their productivity. So it's actually a time which we all are going through of stress and crisis, and we feel that we all have to come together as a corporate entity from a social cause perspective, from our own initiative, and together as a community rather than working in siloed industries and vertical. So I would request to quickly play the AV of Arogya World, which we have done great initiatives in the country. And Sheba, if you can please play the AV. Over to you.
Non-communicable diseases or NCDs such as diabetes, heart disease, cancer, chronic lung diseases are responsible for nearly 2 out of 3 deaths in the world today. Arogya World has currently focused its work in India, often called the diabetes capital of the world. More than 72 million Indians have diabetes.
Diabetes is preventable with 3 lifestyle changes according to the World Health Organization. You have to avoid tobacco, you have to eat right, and you have to exercise. We are a chronic disease prevention organization that promotes prevention through healthy living and lifestyle change.
Arogya World's doorstep model takes prevention programs directly to where people live, learn, and work, bringing better health and lives to individuals and families. Arogya World has reached about 4 million people to date with its prevention programs and healthy lifestyle messages. This includes 150,000 school children and more than 1 million mobile phone users.
What makes Arogya World so impactful is our willingness to embrace cutting-edge innovation and design practices in all of our programming.
M-Diabetes is Arogya's mobile phone message program that creates awareness about the causes and complications of diabetes and teaches recipients how to prevent it. In partnership with Nokia, M-Diabetes reached 1 million people across India and showed 20% impact.
For any social transformation to happen, one has to scale up fast, especially in a country like India where accessibility of healthcare is a problem.
Healthy Schools is Arogya's peer-led, school-based diabetes education and prevention program aimed at 11 to 14-year-olds. Using fun-filled, age-appropriate, compelling activities, this 2-year program increases children's knowledge of diabetes, the way it can be prevented, and creates positive behavior change related to healthy food choices and increasing physical activity.
We were so happy to collaborate with Arogya World and get access to the deeply researched materials that they have developed.
Eating right is one of the healthy behaviors that needs more attention all over the world, including India.
My Thali is a new nutritional icon we're developing for India. It is based on the US My Plate, and it will tell in a pictorial representation roughly what somebody should eat and roughly in what quantities.
My Thali is currently being rolled out to working Indians and urban consumers and will soon be adapted for rural India.
Let's head to New York and bring Nalini in because your organisation...
Arogya World is becoming known in the global health community for campaigning NCD prevention. A member of the NCD Alliance, it participates actively in the task force on women and NCDs. Arogya World has presented at many United Nations related meetings and made a commitment to the United Nations Every Woman, Every Child initiative. It has also made and fulfilled multiple Clinton Global Initiative commitments. The 10,000 Women's Global Survey captured the voices of 10,000 women living in 10 different countries and showed the unique impact of NCDs on women and their families.
We are very thankful for our many corporate partners and individual donors who have believed in our cause and have been incredibly generous in helping us fund our programs.
It's on our watch that diabetes has grown to the alarming proportions it has, and so it is our responsibility to fix this.
Let us stand together in a shared belief that together our resources can exponentially multiply. Please join us to make meaningful public health impact.
Thank you very much, Prashant and Shema. I would like to now request our veteran senior leader from Arogya World to talk about the journey of Arogya World in the country. Thank you very much. Over to you, Dr. Geeta.
The Arogya journey began 10 years ago, and 8 years ago in India, Arogya World India Trust set up a workshop where companies joined together to discuss what should be the healthy workplace criteria for employees. And over a 2-day discussion, this was crystallized, and then it was launched through the health secretary in Delhi. These criteria, the tobacco policy, etc., which they will deal with later, is you will find that it is based very strongly on the framework which you see by the WHO Health Organization, World Health Organization, as well as the World Economic Forum. So the concern, you will see Dr. Nalini Saligram's, our founder's concern about diabetes, and how 66% of the deaths in the world are due to NCDs, of which 80% of those come from developing countries. And unhealthy eating is the main cause for these deaths globally. Next. So the thing is that in India, at least 20% of the population has at least one chronic disease. Chronic disease being either cancer or diabetes or health crisis, heart crisis or lung crisis. And at least 10% of them have more than one. And 50% of the population dies because of these chronic diseases. This concern would not have been very interesting if we could know that it can be reversible. And we need not have to face this kind of impact if we are more careful about our lifestyles. So the other, the focus of Arogya on finding out science-based, evidence-based, data-based activities and programs also shows, based on the 10,000 women survey which you heard, that more than 25% of the family income is spent on taking care of the NCD person, the person who has an NCD. And at least 7% of the people spend at least 50% of the household income on taking care of NCD. So the huge economic loss, the stress, the mental alarm, all this can be avoided by a simple change in lifestyle, which converges with what today we are facing with the COVID thing, as Nandan started in the beginning, a change in lifestyle and a change in habits. Yeah, next. So you find that the solution is, because especially in the case of India, where the scale is too big, based on the other programs of diabetes prevention and then the WHO clinical trials, etc., landmark trials, it is found that 80% of each of these things, diseases of heart disease and diabetes, can be prevented through healthy eating, healthy exercise, and also cancers can be prevented. 40% of cancers can be prevented. Yes. You saw the doorstep model, which we showed you pictorially through the audio video which you went through. Yes. So it is at each level, at the workplace level, at the school level, at the home level, that we are approaching the communities in order to spread the awareness of how NCDs can be prevented. And this converges very beautifully with what is required today, as was elucidated in the beginning of this seminar. Yes. So, but what distinguishes Arogya's work then? If everybody is doing this, then what are we doing different? The first thing is, we are a pioneering organization, which 8 years or 10 years ago, when nobody thought of health as being important to the company, we took up this, and as a difference, with a difference. It is not like any other health award, but definitely a different program, which was science-based, which advocated on the basis of evidence. Or even today, at each stage, we call for evidence, we ask for data. And Arogya has been pioneering and innovative. Innovative in terms of the idea, innovative in terms of the uniqueness, innovative in terms of the process in which it is assessed. When we go to organizations in India, for example, I always say we never give value to life in India. Human life is not much valued. That was the initial thing. Now, of course, today it is different, but earlier it used to be like that. And then definitely health was not given any importance. But today, over these 10 years, over these years when Arogya has worked, we find that when we went to organizations, the very things which they were not doing, today most organizations do as hygiene factors. Everybody has a good cafeteria, everybody has that kind of thing. So, and it will become better now with the attention to these non-communicable diseases plus communicable diseases. So both are now converging to a point when health, safety, and sanitization, etc., and environment is so important. So through partnerships, through this doorstep model, through innovative changes in our product, in our process, through the transparency and the uniqueness of approach and the pioneering way in which we got on companies to become healthy workplaces, to make them come onto the bandwagon of healthy workplaces, is a mechanism which is very unique to Arogya. So at one end, you will find Arogya World connected to the global framework of health led by WHO and World Economic Forum and others. And at the other end, you will find us linking ourselves to the government programs of the Sustainable Development Goals, such as Eat Right and Poshan and other programs. So Arogya World is in a very, I should say, a very enviable step, enviable post, where it can contribute to both ends of the thing, of the spectrum, and help employees, school children, homes, and others go on to the healthy path. I will now request Ashwini Thakker to take on the the WHO framework and go a little bit into detail, which is relevant for companies who want to involve themselves in changing not only the course of chronic disease, but also coming on to the COVID platform and facing that peril as well. Thank you.
Thank you, Dr. Geeta, for sharing your insights. Indeed, I think we are living in a strange world right now, and we are facing strange times right now. Like she said, that earlier where health and wellness were good to have, now health and wellness requirements will be a must have. And like we heard in some of the webinars and some of the leaders speak, that employee well-being is now going to be a serious boardroom discussion. Nandan?
Unfortunately, Mr. Nandan got logged off. I think his electricity went off.
Oh, okay. So can you just share the slides? We are living in a digital world, and we'll have to face these issues till we all get used to it right now.
I don't have the presentation with me. If Ms. Shima has it, then probably she can share it.
Okay. Shima?
Hi, Shima. Let me see.
While we are waiting for the slides to show up, I can just continue and discuss. I mean, without the slides also is fine. So basically, what we are trying to say is that employee well-being is going to be, so not only well-being, it's going to be employee safety and employee well-being are going to be two most important factors, while employees are now, or employers are planning to start returning back to offices. This crisis was unprecedented. Nobody was prepared for this crisis. But like Nandan said, that it is always a phase of learning, and we will be in a different world. I mean, we will be living in a different world. There will be different challenges, but there are always solutions available. So going back to the health and wellness, WHO has developed a very beautiful framework, and healthy workplaces is one of the one of the most important things that is being talked of right now. But it also needs to start with the what and the how. So why are we doing what we are doing is the question that we need to continuously ask ourselves. It all and just to share some examples, some progressive organizations have started this health and wellness, which we have interacted with initiatives many years ago, and we at Arogya World are fortunate enough to, have insights of what other companies are doing. So the ethics and values, I think it is very, very important. So with ethics, basically it is finding trust. So the employers need to build that trust amongst employees while running any initiative, whether it is health related, whether it is non-health related, that it is for in the best interest not only of the organization but also of the individual and of the employee. And it is anything that we do is only going to help the employee versus create insecurity. And value, so what is the value that we are adding by doing these, by introducing these initiatives? What is the value that we are adding? I think this is the question that we need to that each each employer or each large organization needs to ask themselves, and then work around a beautifully given framework which is already available, looking at the physical work environment, looking at the personal health resources, what is the enterprise involvement, and most importantly, the mental well-being. So what is the psychosocial, what is the psychological work, and what is the environment at work, which actually supports employee mental well-being. I think that is one of the most important things that we are talking about. And just saying about, when I say about mental well-being, it's not just providing resources which is like counseling resources, but also creating an environment which is non-judgmental and which allows the employee to be the whole person that they are when they come to work and when they are at home. So I think it's just, achieving a balance in body, mind, and spirit. I think that is very, very important. And Dr. Poornima is here, so she will definitely take us through that in detail. But I think these are the most important things. Again, the next important thing, so while we are setting up a framework, while the framework is being set up, it has to have an end in mind. So why are we doing what we are doing? I keep repeating this, but this is one thing that I have learned from my previous organization, that we need to ask ourselves this question: why do we do what we do? What is the purpose? What is the purpose? What is our purpose? And that is something that we need to keep asking ourselves in any program, in any initiative, in any initiative that we deploy. One of the most important things, again, around health and wellness is health and wellness. I would say is a very personal area. And when any organization tries to create that culture or tries to create that trust, continuously has to be there. So it's not only a top-down support that we are looking at, but it's also a bottom-up engagement that we need. So excellence in services, I think that is one of the most important things which we need to ensure that the services that we offer our employees, because that is going to create value. And the second important thing is, again, to simplify and to standardize. I think standardization is most important. There are many organizations which have a decentralized approach and many organizations which have a centralized approach. But whether it is decentralized or it is centralized, I think standardization is very, very important. And there should be policies, basically. So this is what we are hearing, this is what we are learning, that now there is scope where organizations will need to create or need to have policies or need to have guidelines around employee health and wellness. One, because again, just sharing some of my previous experiences, that there have been organizations who have a lot of health and wellness initiatives for employees, but um, there is no data. There is no data that, are these initiatives actually helping our employees? Are these initiatives, what can we do better? How can we, so it has to be measurable, it has to be outcome oriented, it has to be evidence based. So that is going to create value. And that is what, as it is very well said that, leading the business, leading in businesses by leading in health is now going to become the key business imperative. Um, can we have the next slide, please? So, having said about, having said about the framework, the goals and objectives, now, it is very important to again have the execution. So the services, the solutions, and the strategies. And again, in different organizations, there could be different. So for a manufacturing location could be, the requirements could be different from a non-manufacturing location. And just to go back to our regulatory requirements in India, I think the regulatory requirements for a manufacturing location are at least documented versus the ones for a non-manufacturing location, which are not clearly documented. But like I said, earlier, we are in strange times, and and now is the time to actually, document all the processes, whether it is all the initiatives that we have towards employee health and well-being, irrespective of whether it is manufacturing or non-manufacturing. And that is where, Arogya will, kind of help. Arogya will support to create or to help create these guidelines, or help or become your knowledge partners in creating different guidelines, which will be data centric and outcome oriented. There are different, there are different organizations where there are different policies, there are different strategies, and there are different basically implementers. So so at a strategy and at a policy level, I think the leadership buy-in is most important. There could be different policies, and again, each organization could have a different approach, but as again, as guided by the WHO framework, basically to reduce the non-communicable disease burden, and now also to be prepared for this, to be emergency preparedness is now again going to be of utmost importance, because of the current times that we are in. There could be different policies around, tobacco-free workplace policy. There could be health and wellness policies. There could be employee mental well-being policy, a healthy eating policy, and there could be different policies. There could be different guidelines and standard operating procedures. So all these have to be put together, and again, I keep referring to the WHO model, which says plan, do, check, and act. So only then can we, we have to start planning, we have to start implementing, we have to check whether our programs and our services, how is it helping our employees? Is it helping them? Do we need to change them? Can we do something better? And then accordingly revise our revise the policies, or revise the there is scope to revise the outcomes, and work towards getting being a healthier workforce. Also, I think one most important thing for employers is, if we are expecting that our employees need to be healthy, then we need to first create that culture of health at work. So are we creating such a culture where the healthier option is the easier option? that is the question that we have to again, keep asking ourselves. Is the healthier option an easier option for our employees? If we're expecting our employees to be healthy, are we providing them with the right resources? So these are, some of the, things that Arogya can support in, and support in giving the right technical direction, providing subject matter expertise, helping you develop and deploy the right program, and also provide training where required. So without further ado, I would request my colleague Usha Chander to take you through the process. So we have one of our programs, which is the Healthy Workplace Programs. It is our flagship program, and nobody better than her can describe this or take you through this process in detail. Over to you, Usha. Usha, your mic voice is mute. Yeah.
Thank you, Ashwini. Good afternoon.
Your mic is mute, Usha.
Going back to mute, that's been a lot of disruption at my end on the electricity, so it's coming and going all the time. So team, I would request you to take up if I go off air. So good afternoon. Of course, I'm very confident that you'll do a much better job than I will be doing right now. So good afternoon, friends. So corporate wellness programs, will all agree, are gaining momentum in India, more so during this COVID-19 period, because it's affecting health and wellness of people. So till now, health and wellness, as Dr. Geeta said, was perhaps in the back burner. We won't say it was indeed in the back burner, perhaps in the back burner, but because of all that is happening around us right now with the crisis and everything, we are now again focusing on health and wellness. And because employees are the major assets nowadays in this knowledge economy of all the industries, we have to focus on employee health and wellness. So I'm sure you'll all agree that, definitely workplace is an ideal setting to integrate lifestyle-based health habits in today's often hectic schedules, be it work from scenario or be it, at workplace. So there are very associated challenges, with each situation. And in order to overcome those challenges, much of our life's time is being spent on that. And to pursue some focused health goals, personal health goals, and to eat right and look for the right kind of ingredients to cook a healthy meal, all these things then become a daunting task. And then we often tend to push it back. So, now we're saying that we are encouraging the employers actually to come up with a very highly supportive, strong and supportive platform where these employees can integrate lifestyle-based healthy habits into their hectic schedule. And we would aspire many companies to also integrate structured health and wellness programs into their strategic plans. All that has been described just now. It has been explained by various team members of Healthy Workplace team. And we would, it's our aspiration that many companies would integrate structured health and wellness programs into their strategic plan and report the program's impact. As Ashwini rightly pointed out, programs' impact on promoting employee health and wellness and ultimately preventing chronic diseases. So you could say, I'm taking again the same statement, we keep reiterating this to bring home the fact that organizations have to follow an evidence-based, data-driven, outcomes-oriented approach while deploying any health initiatives. And these outcomes, learnings that emerge from the outcomes are plugged back into the system, and the programs emerge much stronger and in a much more improved fashion. So this continuous loop of improvement goes on, and eventually the programs become much more strong. Now, to take you through this program, our evolving Healthy Workplace program, we will be starting at the pre-accreditation at the bottom of the arrow. This is one of my favorite slides, because it really shows hope, and then it shows the progress of the program from where you are to where you would like to go and where Arogya World would like you to go. So at the pre-accreditation stage, companies review what we give them, they review the criteria. If you remember, Dr. Geeta spoke about WHO guidelines and, this multiple stakeholder input gave rise to certain criteria, and she said it will be described later. So I take it up from there and then I describe the criteria for you right now. So we give the companies 5 very, very simple criteria, which is tobacco usage or tobacco policy, and then healthy eating, physical activity, work-life balance, shifting mindset. So these 5 very simple, doable, realizable criteria we give to the companies, and then we ask them to kind of review their programs, at the pre-accreditation stage. It is like a self-assessment exercise, self-evaluation activity. We tell the companies to review their programs under these criteria and then come up with a filled questionnaire. So the questionnaires that we will be giving to the companies, our touch point, of course, ultimately are the employees. But then we try to drive all these initiatives through the employers. So we'll be talking to the leadership team of the company and then ask them to fill out a questionnaire, which is based on our 5 simple criteria. And once this submission happens, once the questionnaire is in our hands, we set up an assessment date, and then we take a 3-member team to the company, do on-site assessment, and we also do an ocular inspection of the area. A very, very simple, very enabling kind of an exercise, but at the same time, we do not compromise on the rigorousness and the transparency of the operation. So this in-person assessment takes place with a 3-member team. The Arogya person will bring a medical expert, medical practicing doctor, and let's stay on that, Nandan, on the same this thing. So I'll come back to the criteria again. So medical doctor, an industry person, industry expert, and of course the Arogya. So we try to give you a 360 viewpoint of the assessment. So medical perspective, because it's a public health intervention. Industry person brings in the industry trends, current trends that are in the industry, and the Arogya very unique perspective from the Arogya world of having viewed 131 companies closely as far as the health and wellness of their employees is concerned. So we bring all the best practices to you so that the companies can benchmark themselves against those practices and set the path for improvement for themselves. So we will be taking you, of course, we don't say that you will necessarily be in the bronze level. So whichever level, I'm going to describe from the bronze level to you. So we'll be taking you from the bronze, silver, gold, platinum to the Hall of Fame level. Till the gold level, the bronze, silver, gold level, the assessment is qualitative. We just give you certain areas of improvement. When we do the assessment, we not only congratulate you on all the good effort you have put in. Remember, our program is not punitive, our assessment program. We do not punish companies for what they don't do. Rather, we congratulate and enable and kind of felicitate them for whatever they're doing, all the good work that they're doing. At the same time, we also highlight areas of opportunities for the company and give them certain action points where the companies then start working on them. We will be hand-holding them throughout this journey and helping them wherever we are required to help. Once the goal level is reached, we introduce the data-driven initiative that Dr. Geeta was talking about and everybody else was also talking about. So we introduced the concept of measurement, metrics, because what cannot be measured, surely everybody will agree, cannot be improved. So once we introduce the data metrics, then we take you to the platinum level, where we say that, we ask for all related data, participation rates, and, all those kinds, how much of budget are you allotting, how many people are actually taking care of the program. So we take you through a beautiful data journey in the platinum level. And once you clear the platinum level, we take you through the Hall of Fame, which is the ambassadorial level, where we expect you, of course, now that you have done stellar work as far as employee health and well-being is concerned within your organization, in your organization perspective, we look forward to your involvement in the community. We look forward to your influence. You're bringing in certain other, not only companies, your associates, your suppliers, and all those people into this web of healthy workplace and well-being. So the criteria that I was describing to you, I will very quickly go over it and then maybe have the next slide, please. So as I said, these are the 5 simple criteria. I will just walk you through the healthy eating criteria because that seems to be very relevant now in today's setting. Of course, all our criteria now are undergoing a transformation to suit the COVID scenario, to suit the coronavirus scenario, because now it's going to be all disruptive. People are, half of the population workforce is going to work from home. So we are also in a state of curiosity to find out how effective these health and wellness programs are going to be for all those people who are going to work from home. So how are we going to extrapolate this to suit that situation? So we will not go into the details of that because there is, the time is at a paucity here, time is at a premium. So we will I will just walk you through one of the one of the criterias which we normally do under regular circumstances. So if you look at this healthy eating, at the bronze level, we require a basic, we require the company to follow a basic level, which is just make available affordable healthy food. Of course, everything has to be National Institute of Nutrition compliant, because without that, we will not be making sense when we say that we are promoting healthy eating. So that is the basic requirement at the bronze level. Now, when you go up to the silver level, on that criteria, we expect you, not only should the healthy meals be accessible, it should also be, food should be prepared hygienically. So there is a slight escalation in the requirement, and so on and so forth in the gold. Now in the gold, we will be seeing, looking for no trans fat usage. So like this, every criteria escalates in its requirement when it progresses, when we progress from the bronze, silver to the gold level, or rather when the company progresses from the bronze to the silver to the gold level. Shifting mindset is a very interesting criterion. Here we look forward to leadership involvement. How best are all these programs that are in the company, how best are they communicated to the employee? The standard question, the very favorite question of Arogya World team is, how do you, to the leaders is, how do you ensure that your program reaches the last of the employee that is standing in the line? So that is very, very important. There may be many programs running in the organization, but if it really doesn't touch the life and the heart of the employee, then it falls flat. It holds no meaning. So leadership involvement, their blessing, their buy-in, and then their way of communication, their way of handling the programs, their way of providing the proper direction and proper vision is all very, very important. And for us, the shifting mindset criterion is also equally important. Now, once we go through the criterion, we assess you, and then we pronounce you winners. We will invite you to a conference where we'll felicitate you, and we will, these words, we do both facilitating and felicitating. So it keeps crossing. So we will felicitate you in a conference, and then we will also read out a citation on the company and highlight all the good things that the company has done towards employee health and wellness. Now, in this era, especially in this COVID era, everything I think is going to turn digital. So we may end up having digital assessment. We may be assessing you through, digitally, and then carrying on the site visit at the first available opportunity. And we may also be conducting this Healthy Workplace Conference digitally. So we are also equally eager and anxious to know how things are going to pan out and how we will be able to start with this program for all the companies. Now we follow a very, very simple Healthy Workplace scoring grid. I won't go into the detail of it, but we will definitely explain this when we go for the assessment. We'll tell the companies how we do the scoring broadly. We don't take you through every detail of it, but we'll broadly tell you how we score you. So this is the scoring pattern, which will be shared with the companies at the outset. So now, after going through all this exercise, let us assume that you are onboarded as a healthy workplace. Congratulations, welcome to the group. Now, we will then, Nandan, next slide. I think Nandan has gone off air. Okay. So once you are onboarded as a healthy workplace, we will then be talking about our offerings to you, irrespective of which level you are in. But then we would ideally look at this before you apply to the platinum level, which I said is the data-driven level. So from bronze, silver to gold, it is qualitative, and then the quantitative aspect of the program begins. So we will be introducing these program offerings for you, and our offerings have been, carefully thought out, very carefully designed and curated just to suit our healthy workplaces and to give maximum benefit to all our healthy workplaces. So first one in the package is the communications package, and that we of course has a lot of motivational messages. which we categorize into, diabetic prevention. We categorize it into hypertension prevention. We have introduced stress management information also, stress management module also in it, which has been helped out by Dr. Pratima Murthy of NIMHANS, and we have a representative from NIMHANS here. So Dr. Pratima Murthy herself helped us come up with those messages. And we have all these motivational messages that we hand over as a soft copy to the company. We also format it in different, there are danglers formats, there is a poster format, and then there is also tent card format, which can be kept on the table. We also give electronic display format. So several, we include all that and give it to the company, and they can put their logo and then deploy it, disseminate the information within, depending upon how their convenience. And we tell the companies that they normally have to do it 6 months to 1 year. This communications package has to be deployed, rolled out. Now, then we come to the My Thali, which Dr. Nalini already explained. My plate concept, and My Thali, of course, is a pictorial representation. It's a nutrition icon. And here we have included a lot of very interesting elements to it, over the years, because it has also undergone a lot of transformation. And now My Thali looks very, very comprehensive. And, we are very sure that it will bring a lot of benefits to people on eating right, eating healthy, eating nutritious food, and so on. Now, the My Thali, of course, we have rural My Thali now, urban My Thali already existed, and then we have for us adolescent period, adolescent children, young adults, and then we also have for, moderately active people, highly active people, and so on. So there are various gradations, and we offer webinars, we offer digital booklet of recipes. Then we also help the company chalk out a diet plan for all their employees, and then we bring brown bag seminars to them. And now, of course, everything has to be digital, perhaps at least for some time. So we'll be doing all these things under our My Thali program. And then, of course, we have one other program, which is called the Lifestyle Modification Program. Can you show that slide, Nandan, the Lifestyle Modification? Yeah. So this is Training the Trainers program. Now here we actually look at the lifestyle of a person getting modified, changing, and then which would ultimately lead to prevention of chronic diseases. And in this case, it'll lead to protecting the person against this COVID and coronavirus, COVID-19 and coronavirus. Now, this lifestyle program actually has been promoted by Center for Disease Control in the US and Emory University. And the curriculum is a very interesting curriculum. There are a lot of interactive modules and so on. And the curriculum is also done by Emory University. So we've sent our master trainer to Emory University, and he is trained in coaching the coaches of your company and bringing them on par with this lifestyle as a lifestyle coach. And once these trainers get training, it's a 2-day intense workshop. Once these trainers get trained, they in turn go back to the organization and roll out this program for 16 weeks. And real perceptible behavior modification, perceptible changes in lifestyle has been observed when people have been put through this entire lifestyle change program. So this is actually Training the Trainers program, and this Arogya World will hold your hands in even selecting the coaches and then guiding you through the entire process. Now, with all this, I would say that, Arogya World Healthy Workplace Programs, it's very, very close to all our hearts. We're all bound by this. And we believe that holistic well-being strategy, is not just about providing a bouquet of programs, but also it's not just about providing, but also about ensuring that healthy lifestyles are embedded in the organizational culture through communication and engagement strategies, supported with metrics and viewed as a business priority. So we urge you today, because the entire reason for doing this is to motivate you to become our partners, and together we'll be changing the course of chronic diseases, and we would like you to adopt this healthy workplace in your organization and help us go forward in our mission of changing the course of chronic diseases. Thank you. Nandan.
Yeah, thank you very much, Usha. I think it was very detailed, and I'm sure corporates have understood the importance of health and wellness and how Arogya can partner with. And I think, as you rightly said, we can be a strategic partner for corporates to guide companies towards towards the health and mental wellness. And our USP is actually the simplicity of our program, which is very, very, very easy to implement. And today's scenario, if you see during COVID-19, I think it's certainly a need of an hour. So I would like to quickly say that what's in it for companies, who are participant today. And I myself has benefit, when I was working for Britannia Industries, and we have adopted the program of AROGYA'S Healthy Workplace, and we have found such a positive results, and we are very glad. So overall, if you see, these are some of the concerns areas of the leadership team, especially from the CHRO perspective, that how do you manage the employees' healthcare cost and the compensation claim. So I think with health and wellness, it's important. It is the desirable result through the AROGYA'S program. It also reduced the cost due to absenteeism. Improved employee health with the focus efforts what has been put in through AROGYA'S program. And overall, if you see there's an end result, it enhances the employee performance and productivity, which is critical at this stage. And overall, if you see the benchmarking opportunities, as we have 131 companies currently, and our target is to reach to 200 companies and touching at least 5 million employees in this year. So we have the pioneering set of the AROGYA'S criteria and the best practices we can share, which helps to ensure that there is a greater ROI due to enhanced productivity, and overall driving the wellness program on CSR activities, advanced communities, economic and social conditions to enhance that. So I think that's very, very critical on a wellness perspective. So I feel that all the organizations who are attending, please do contact us and see how we can be your strategic partner on this important journey to manage the current pandemic and driving the health and wellness programs, policies, strategies, and establish the guidelines towards that. We are glad that every year we have the Healthy Workplace Conference and Awards, where we give the companies on a level which Usha has just explained, and we create a platform for them to share the best practices what they have adopted in the interest of other corporates also. So this is what is on the felicitation what Usha was talking about, and we are glad that our 2019 Healthy Workplace, which is #1, is a Hero MotoCorp, which has been awarded on the global platform for the healthy workplaces. And we really look forward that all of you should be a part of this journey of Arogya World programs. In fact, just to give you a glance of the companies who are proud partner with Arogya World on Healthy Workplace program is Capgemini to Dalmia to HSBC, and all the large companies from P&G, Thermo Fisher, Godrej, and they are proud partner of ours. In fact, some of our association, because this journey is quite difficult to actually execute in the country, and we have great partnership with some of the association which is on the Healthy Workplace initiative, like Corporate Association, Infra, GSES, and we are glad that Cigna is part of our platform of a partnership. The Clinton Global Initiative also gave us the platform for this effort. In fact, PHFI, who is again a partner on the Healthy Workplace Association perspective, IOH, which is Indian Association of Occupational Health, for strategic collaboration on Healthy Workplace. So these are some of the list of the partners who have been helping us in terms of driving our initiative. And in fact, if you see, there is a convergence, which is for the current employees on managing the health crisis at this moment in companies, and overall Arogya's program, which really integrates very well. So I'm confident that can be achieved in terms of the goals of the organization, and we are glad to help you in that. Without taking more time, I would request one of our Healthy Workplace, which is Toyota, Dr. Kowshik, to please talk about the best practices, how he has driven these initiatives on Healthy Workplace perspective, and what is his experience, and some of the points he can share with the participants here, it would be great. So over to you, Dr. Kowshik. You can just set the context. In the meantime, I'll open your presentation and you can take it forward.
Good evening, all. Hopefully, I'm able to be heard by all there.
Yes, Dr. Kowshik, please go ahead.
Yeah, good evening, all, and thanks, Nandan, Usha from AROGYA'S and CII for giving me this opportunity to give you a brief on healthy workplace, the COVID scenario, and how we're going to manage further going ahead. Right from the lockdown stage 1 to 4, how we've been faring through and what we expect in the next normal to follow. So to go on with probably the presentations, Nandan, if you can just share.
Dr. Kowshik, you can just talk and then in the meantime, just launching it.
Okay, all right. So as we all are aware of this scenario of the impact of COVID, it's the government trying all the way on physical distancing, isolation, lockdown. What we are expecting and seeing around is not just the disease as such, it's causing an immense effect on the mental and physical health. We see employees' physical health being affected, being, with the new scenario of work from home, different timings of the work, adjusting to the work environment, and also in the mental aspect, they see someone of them is, strangled in between somewhere, not reaching to his parents or to his loved ones, to some of them not able to cope with the nature of work, like the scenario of work from home, or to someone not clear whether his job continues. So there are a lot of mental health issues going to come forward. The physical aspect is somehow, is not manifested as it. So as Toyota, what I'm just trying to show is as a model to maintain an optimum health, it's just not only, one that the physical health which has to be maintained. It is a wholesome gamut of physical health, mental health, and an emotional health, which an individual has to maintain, along with when they are working for a company or in a corporate. We have to make sure that the workplace has a healthy process and the environment where what we work also to be taken care of. So I'm looking at a perspective to have, in Toyota, we consider it this way. To have an optimum health, we have not only to have a healthy person who has physically, mentally, and emotionally fine, but also provide a healthy process at the workplace, which is actually making sure that the risks are reduced to the maximum, ergonomically fine, environment is being managed well, and the environment around the working, including the food, waters, as such, Arogya was talking of the healthy food or thali, all those things, considering a wellness food, how to rehabilitate if someone actually is, ill or injured. And very important part, as a part of healthy environment, is infection control. Probably going forward, infection control at the workplace would be a major criteria and a game changer, which has to be followed as per the government guidelines also, which includes like physical distancing, hand sanitizations, wearing masks, declaring yourself clear and fine before joining work, and etc. etc. So I would just, if Nandan is ready, I would. Nandan, are you ready with the PPT, or shall I continue with that?
Dr. Kowshik, my screen is being shared. Can you see these slides? Usha, are you able to see my screen, which is being shared?
Yes, we're able to see the slides. Dr. Kowshik?
Can you just see that what the slide I sent, the second slide, the second ones, I think I sent it to one. The second one would be the right one, I guess. Anyway,
Go back.
No, not this. I guess I sent the second one after this, Nandan, if not. Okay.
So you can continue with this, doctor? I think this is more or less same, or you want me to?
You just try to put the other one. I guess it's just sent. Now, anyway, I will continue with my talk, so you can just prepare send the second slide what I sent you through mail right now. Or can I have the option to share? Can you give me the control to share the screen?
Prashant, can I request you to please give the rights to Dr. Kowshik for sharing the screen?
Yeah, Dr. Kowshik, you now have the access to share your screen. Please go ahead.
So I will stop sharing now, Doctor.
Yeah. Is it visible?
No, Doctor, you need to go to the slide, share screen and then slide. You have to open the slide and that will help you to present it.
All right, probably, Nandan, I just give back the controls to you. I'm not sure. Probably.
Nandan, I have shared Doctor's latest one with you.
Yeah, I opened that one only. That's the one which
340.
is being presented in terms of best practices. You want me to share, Doctor, the same one?
The second one I put as, the heading is corporate or something. It starts with corporate when this employee health. Is that the...
This is the one, Doctor. I just give me,
All right.
Emotional well-being on the new normal is something which I've got it. I will.
Sorry, I think I said the wrong one. I probably corrected and sent you. Probably that's the one. I guess the caption is corporate employee health.
Mr. Nandan?
Yes, Prashant.
Are you sharing your screen?
Doctor, should I share it? The one which I have just opened it?
I'm not able to see now.
So, if, Mr. Nandan, if you could just share your screen so Mr. Dr. Kowshik can also see, and then see if those are the right slides, and then we can move ahead.
Sure. 1 minute, please. Okay, Prashant, I'm not able to share the screen. Can you help me?
Okay, are you able to see the icon at the bottom that says share screen?
Yes, I am doing that, but it is not responding.
Okay. So I can see Dr. Kowshik has shared his screen now. I think we should be okay.
Can you see the...
Dr. Kowshik, we can see your screen. Please go ahead.
Please go ahead, Dr. Kowshik. You can put it in
All
a
right.
screen mode. Put it in
All
a
right.
presentation mode.
All right, wonderful. All right.
Great, thank you.
Sorry for that technical hitch. Something.
Go ahead, doctor.
Yep. All right. I just going through the scenario. What we are seeing is the World Health Organization themselves are saying that a global economy of $1 trillion is going to be affected. And when I see in Toyota how we are managing a healthy workplace is to make sure that we have a healthy persons in place who are physically, mentally, emotionally well, having a healthy process and a healthy environment. So in a healthy environment, what we are looking at the most important aspect post-COVID or post-lockdown is infection control at the workplace. What I was telling about, the social distancing, your hand hygiene, to your making sure you are not sick before coming to work, all those aspects comes into play. Looking at evolution of this healthy workplace, yes, an organization to go to the level of health and productivity to improve based on healthy workplace, almost all starts with a small programs where illness and injury management is the first aspect. Like inside a medical hospital, in a corporate, we would say I'd set up a small first aid center or a medical facility, a doctor around a nurse, just to make sure that illness injuries are managed while at work. Followed by, okay, corporates go to the next phase where they go on to make sure that the fitness part is considered, like they go for a health check to make sure the risk assessment of employees are taken care. And then the third phase, they go on health promotion and wellness. Probably most of the companies have gone to the phase of this where health promotion and wellness, which includes to, make sure that employees' health are bettered on and giving them an option on wellness. So wellness involves many aspects, as already Arogya team would have already explained on. Wellness is a multi-dimensional perspective. It is just not about just making physical health, it's about emotional health, it's about mental health, it also includes spiritual health. So it is a multi-dimensional aspect, and picking up a wellness program is a crucial, very crucial for companies on which aspects to pick on to begin with. Health and productivity, the last phase, where based on improving the employees' health and health and wellness, how a company can benefit to get an optimum productivity. So that's the highest stage. It just involves not the first phase, second phase, third phase. If you're completed, you are looking forward to see that how your company can look at return on investment based on all the activity which you have been able to take over. And again, when we see wellness or health, workplace wellness, it's just not that it's activity going on in silo. I would be doing an activity on yoga at the workplace, or else would be doing a health check at the workplace. Someone who look at safety would look at injury prevention at workplace. What as a complete package, if you would like to see, any of this wellness program has to be totally integrated under one umbrella. The top management should be able to direct from top down how to take about this program, and this all activity has to be interlinked and integrated. So we've got to see that in one umbrella, the health, safety, HR, and stakeholders, including the union, if you have the employees, all should come under one umbrella and have one voice to make sure the program is successful. So having a right leadership, having a right engagement, and basically the processes in place, we can see a higher engagement and improved safety and productivity overall. Just this slide, quite a little fascinating. I just included this to ensure during the COVID, what was the stages of mental health aspects, what we had gone through. And stage one, we had a disbelief with sudden lockdown, shock, denial, which we're seeing people panic buying of all these sanitizers, masks, followed by the stage two and the second stage of our version 2 of our lockdown started. Then we started blaming each other and having an anger and expressing this anger. And in the stage 3 of our COVID, people started thinking about, oh, my work, whether I would be there inside my company, how would be my future, what would be my career. So the feeling and expression of hopelessness, helplessness, and worthlessness starts down. Probably on the phase 4, when we get back to work, we start accepting the fact that this is the reality, and we get back to stage of optimism and to the next level, which we call the new normal. All right, this slide may be not much of importance, just it's ideal to understand and recognize features of depression. Some of the features of depression include sleep problem, lack of concentration, forgetfulness, couple of these activities which can have impact on the workplace. Like if someone has been deprived of sleep for a long time, when he gets back to work, we can see a lot of mistakes, errors, accidents in workplace, followed like aches and pains, where there would be a lot of trips to doctors, and someone with lot of concentration will be not able to perform his job. So these are some of the distress symptoms what supervisor should be able to recognize post-COVID. As you see, the individuals would be under tremendous amount of emotional trauma. So to come back again, how can I stay mentally healthy? So the simple things, what you got to feel, make sure you have a regular routine. So don't get up at 7, instead of 6 in the morning, don't get up at 10 and have your breakfast at 12. Just stick on to a regular routine as if you are going to to your workplace on a regular day. Maintain your schedules on exercise and physical activity. Have a balanced nutrition. Set boundaries for social media consumption. That's the biggest thing. Right, have the right facts known rather than getting into the sensational news. always we say it is not the social distancing, it is a physical distancing we got to maintain. And since socially we are all supposed to be social animals, we look to actually have people just a meter, a meter away or 1.5 meters away, but then we don't ask you to totally just shut down yourself inside and not connect to people. So connect to people, but then maintain the physical distancing. And whenever you recognize someone with a mental health issues or recognize symptoms, kindly support them to seek the mental health resources. So this is just some of the tips to keep yourself healthy. As an employer, as a company, as an employer, what you can do for your employees during this stage as of now and to the transition to the next stage. What at Toyota we are looking at is total reset for us. The next normal, what we see when they get back to work will be totally new. So they got to really unlearn the whole thing and reset and come back with the new normal mindset, relearn, again, put their old baggage out and actually carry on with learning new things. Maybe working from home would be the next new normal. Many of them are not used to this, working from home option, particularly in industries like, auto industries. They are physically supposed to be present at workplace. We may have to see all the office side employees had to be working from home for a long time going from now. And the third part is reset, relearn, and the third point is rejuvenate. Just having the reset and relearn would help them to mitigate a couple of the risks, including their safe social security, etc. But to connect them into a feeling of having body, mind, and soul connected well, we have to have workplace programs in place to rejuvenate them. So this is something we are working on. And it is still in a stage of infancy for us to have this workplace wellness program other than the established program for the new era, what is the post-COVID era, what at the workplace we want to do on. So just to give some example, for Toyota, when we are fighting against COVID, we had been supporting employees, their families, to our stakeholders, that's the suppliers, the dealers, etc., and also the community around the whole districts where we operate and the surrounding area. We supported on some of the activity to protect these people in one or the other ways. To employees, first thing is basically an empathetic leader. As an empathetic leader, we saw our managing director stay, communicating to all the employees and the family to stay calm, relax. We are there with you. Let's work together for the future of the company. And we have something like for the new normals, we have some aspects on policies like stop the jobs which are not required, change and work forward for the new dimensions. And let's work as one team and one goal. And to engage the families, there are activities like, selfie competition, drawing competition, photography. These are just a way to engage with the people since they are basically spread across to their hometowns, not just in, Bangalore, they are spread across Karnataka and maybe some are out of states. So we are connecting with all of them and engaging, making sure that they're still a part of the place, 40 to 50 days of lost days connected. It's really, really tough to get them back to normal easily. So some of the other aspects related to yoga, meditation, including our vice president himself, takes on to a video communication mode, connecting to the team members and practicing them and teaching them how to meditate, how to make practice yoga. And we have some pledges on how to make sure that everyone wash their hand in every aspect, when to wash their hand, how to do it, etc. Employees at the time of COVID, we may see the medical system and all the medical facilities overwhelmed. So we may see our employees not able to reach to the hospital. So we have already an one-to-one counseling through telephone, or it could be video counseling. We have a teleconsultation with the doctor available. So there are a couple of teleconsultation modes to the doctors, to the counselors, made available to employees and their family free of cost. These are some of the activity on employee assistance programs we are doing, and we are working further to see that in the next aspect, what we have to do, how to support them at the workplace too once we start working, post-lockdown. To the stakeholders, we are seeing that our suppliers and our dealers are very important aspect to us to continue the business, for us to continue the business. So we have given the know-how how to restart the company post the lockdown. So this know-how we have shared across to all the companies, the dealers, suppliers, including others, other companies as a ready reckoner. So we have the know-how on how to manage the workplace post-COVID. So we just given them the pictorial diagram before and after, what is the changes, how we got to manage. Plus we helped a couple of the suppliers to ramp up their production, which they were producing some other springs. So we made them to ramp up to produce face shields. They had a capacity of 500 per day. We ramped to produce, help them with our technical know-how, how to produce up to around 15,000 PPEs per day. So these are small activities we were able to do during the lockdown. And of course, for the community, the hospitals around, including the district and, to the states, we are able to supply thousands of PPEs, including all the equipment, vehicles, etc., including for the people who are daily wage, not getting adequate food supplies, supplying them food items, etc. So coming back, what we expect from the employees to do following them getting back once the lockdown is over, we expect them to involve in following the directions from the company policies and procedures, like, they have to self-declare when they're sick not to come, how to follow the direction, like social distancing, washing your hand, etc. Also, we look at the second I, involve and indulge in healthy behaviors, no tobacco, chewing, smoking, taking care of their health, physical activities, all those healthy aspects, and inculcate practices like personal hygiene. So these three we are trying to put it as a golden rule and ensure that the employees follow all these aspects, what is required to prevent people from getting infected during work or protect people from transmitting such infection within the company. So in fact, we have a team of 25 people called supervisors who are specifically designed in the company, designated in the company. Their job is purely to make sure the regulations of involve, indulge, inculcate are being followed 100%. And they are called the COVID warriors inside our company. So their job is just to go monitor and make sure all the things are in place. Just to give a glimpse of the restart manual, this is a manual with 50-60 pages on. So just giving a glimpse of it. So the manual starts with just giving a background to how you have to start from home, on what safety you got to follow at the company, and what are the facilities the company offers to you to keep yourself, safe, and also how you got to go home and keep yourself and your family safe. So these are a couple of the glimpses what I put here. We expect the supervisor not only that the employee follow this rule, the supervisor should be able to have 3 R's as a qualities. One, the supervisor should be able to reach out to each of their employees or subordinates and make sure they ask one question first: are you okay? And we find that it is the most powerful tool to communicate and connect. So since our employees are spread across probably around 18-20 districts, reaching them twice a week by the supervisor is mandated during the lockdown, and to ensure that each of them are safe and they are not infected or there are any issues, we as a company, they will report us and we make sure that we provide them the required facilities or support. Respond. We as the supervisor just don't react immediately if a member has something. respond, take properly, understand his concerns, and then respond properly, don't react, respond with a solution. And then if we identify someone has an issue, either physical, mental, or other any, how we got to refer them to the right channel to make sure that they get the support. So we are going to see the next normal coming in. At the phase 1, we are in the phase of resolving by having this lockdown, making sure employee safety, response plans, etc. in place. Over time, we see the resilience, and we, as of now, as we are talking, we are seeing that we got to build this resilience, including the World Health Organization, the leaders, from the political leaders, start feeling and expressing that we got to live with the virus. We can't anymore shy away from the virus. We got to live with the virus. So we got to build a level of, resilience to make sure we can sustain ourselves and also ensure that economic and socially we are able to sustain. We just can't sit at home all through from now on. Over time, we slowly got to live with the virus, follow the golden rules, physical distancing, wearing your mask compulsorily in the public, sanitizing your hand often, making sure you don't come in contact with sick people. So these are some of the golden rules we got to follow and ensure to get back to normalcy and return to normal productivity in the stage 2. And probably in the stage 3, we start reimagining and things would change right from the perspective of physical touch would go off on a, in a future course. And we see a lot of technology, gadgets, etc. coming in where human to human interventions or contact would reduce drastically. Reform, yes, once we see the new reimagination, we would reform and come to a next level of, sustainability where maybe 2 years down the line, the new normal will take us to the next level of reformation. All right, so just to give a small slide on the right side, just to give you an idea how the new normal looks like. Earlier, the employee is to come, he just is to board his bus, get into a his bus, commutation, either his car. He comes inside the company, no one asks him what it is. Right now, before he starts from the home, he has to self-screen himself, make sure he's not sick. And then he has to declare to us that he is not sick, or if he's sick, he has to inform his supervisor. Only then he would be able to get into the bus or into the commutation, where the social distancing is maintained. Earlier, that whole bus was occupied. Now only 30 to 40% of people are occupied. That means one seat, one person, and they maintain a almost 3 feet distance in the bus. The windows are open, no more AC. The temperature check happens compulsorily before he boards the bus. He has to sanitize his hand before he gets into the bus, and he has to compulsorily wear a mask. So you can see the difference. The post-COVID or the new normal would bring in. Right, he starts his day being so conscious about himself and make sure that not only him, he takes care by not transmitting the virus if he has by wearing the mask. So we see right from starting from home, right from his pickup to the bus he sits, the way he walks to the company, he has to maintain the distance. The way he works, he can't come close or physical contact. The way he eats, the way he sits in the canteen, everything would be a new normal now. So we are expecting to see the new normal with all these issues getting resolved. We getting into a phase of resilience, able to cope with the situation, return to a normal productivity, and then we may get to reimagine the whole process to get into a next level of reformation. Just to conclude, whenever a company is looking forward to set up an health and wellness program in place, kindly consider that emotional health and mental health as part of it. And we always advise to see that this focus on not having an issue and then getting into action. probably act on proactively rather than reactive before you initiate these programs. Making the emotional and mental health as a pillar of your wellness program can really make your employees healthier, happier, more engaged and productive. That's it from me. Thank you.
Sure. Thank you. Thank you very much, Doctor. It was very insightful. Now, I would like to request Dr. Poornima to take over and share her best practices with respect to mental health initiatives, which is being concluding the workshops for various corporates. So over to you, Dr. Poornima.
Thank you. Am I audible?
Yes, loud and clear. Thank you very much.
I'd just like able to share my screen. So is my slide visible to everybody?
No, Dr. Poornima.
So I'm not sure why that's not happening because I
Prashant,
don't know
can you
how
help
to
Dr.
enable.
Poornima, please?
Yeah, Dr. Poornima, if you can just open the PowerPoint first before sharing a screen.
It's open.
It's open, right?
It's open.
Are you now able to see a green icon at the bottom of your screen which says share screen?
So I don't know, the screen is not opening up. It's just showing one, yeah. I also sent it. I sent it across. So if you all can share it, that would be good.
Dr. Poornima, you can just open the presentation at the back end and minimize it and then share screen. It will pop up. Your whatever files are there in your desktop, it will pop up.
So Dr. Poornima, once you click on share screen, no, you must be able to see multiple windows. One of them should be your PowerPoint presentation. So you just have to click on select the PowerPoint you wish to share.
Yes, actually, my PowerPoint is okay, but like the Zoom window itself, it's not opening up.
Yeah, you don't have to minimize the Zoom window. You just have to click on the share screen icon at the bottom of the Zoom window.
Yeah. Okay, let me do that.
Yeah, it's
yes.
You can see it. Yeah, we can see it.
Okay, so
just put it in the presentation mode. Yeah, good to know. Thank you.
Is that okay? Yeah.
Yes, thank you.
Okay, so I know we're a little late, so I'm going to maybe speed things up a little bit. So I'm just going to talk a little bit about the position I'm speaking from. One is that definitely I'm a mental health practitioner, so I'll be speaking from that position about employee mental well-being and productivity in these times. I also lead teams, academic and clinical teams at work, so I have that perspective as well. And finally, I too am an employee who's struggling with the changes that we are having at the moment. So I'm going to try and put all these perspectives together to talk about this issue. But primarily, I think mental health is a big concern in our country. If you look at the global figures, nearly 1 in 5 adults have an experience of mental ill health at some point or the other every year. NIMHANS was actually the lead coordinator of a very large national mental health survey in our country. Found that about 10% of our population needs help. Now, we all know how large our population is. So that is definitely a very worrying a proportion of people who need help. A large number of these are the common mental health difficulties such as anxiety, depression, and these are likely to be manifested in workplaces, just our colleagues and maybe ourselves, and so it's all around us. And the survey also indicated that this is more in urban metros compared to rural areas. And I think that's the segment perhaps today's presentation is really addressing. So with such a huge gap, I mean, let me tell you that mental health practitioners in India, they're like a rare species. So there are very few of us, and just simply not enough to meet the needs of all of the people who are having mental health difficulties. So in this scenario, what do we need? I think we are looking really to partner with other organizations that can help us to reach out. Two large segments, I would say, is one is educational institutions, so schools, colleges, etc. And the other very large segment is workplaces. And I think that if all workplaces become more attuned to healthy practices, as we've heard so wonderfully in the previous presentation, then I think we form a team, we join together and be able to reach out to more people. Of course, these are figures from a few years ago, and one might imagine that after the COVID pandemic, in some ways, there is talk also that there may be a mental health pandemic that is on its way as well. So we need to be much more alert and really work together. So it's in this context that perhaps today's discussion is really even more relevant. So what is mental health? Now, of course, there are many, many convoluted definitions of mental health and well-being, but I think this is a very simple and one that I like quite a lot. So Sigmund Freud said that mental health or well-being is the ability to love, to work, and to play. So these are three critical human functions and spaces. And as you can see, work is a prominent aspect. So we need to, a large part of our day is spent at work. We need to feel meaningfully engaged in work, and all of this together is going to contribute to our overall well-being. The World Health Organization has spoken about healthy workplaces in detail, focused on mental health in particular, and said that if we don't address this issue, the worry is that there will be a lot of direct and indirect costs to the organization. And many of the risk factors can actually emerge from both the content and context of work itself. Given the challenges of the current pandemic, job insecurities, sudden advent of technology in every area of our life, work from home, all of these things I think are new worries for many of us. And I think that perhaps all organizations, not just the very large organizations, I think the large corporates have many advantages in terms of the systems that they can put in place, but perhaps organizations in every size, every level need to do what they can. Because I think there are also a lot of opportunities and benefits if we focus on employee mental health. We've heard about it, less absenteeism, more productivity, more engagement, and all of these multiple benefits that can accrue to both individuals and organizations. So now talk a little bit about the current scenario. I think change is the only expected thing that we wake up to every day. We don't know what the newspaper is going to tell us, and really for individuals and systems, we need to have many, many very dramatic kind of shifts. So I'm going to bring in a psychological theory and viewpoint here, that as individuals, what we really want is, we want choice, we want certainty, and we want control. And when these are there, we are just much more comfortable. And when all of these are challenged, it becomes very difficult for us. And I think nowadays there's an upsurge of negative emotions and a lot of what-if worries. Imagined catastrophes in the future, imagined unpredictable, uncontrollable things that are going to happen. I think we must understand that for human beings, this is not at all a comfortable position. It's one that creates lots of anxieties, and as these anxieties brew, they can have a more long-standing impact on our mental health. And also it impairs our decision making, it impairs our ability to engage in work. So currently it's almost like a crisis situation, and the best form of response is to treat it like. What would you do for a crisis response? You pull new rabbits out of the hat which you were not looking at earlier. You will rebuild, you will reimagine, you will reevaluate, and that's really what is called for. So as we look at how do we lead our teams, how do we challenge the current adversities, I think we're looking at how this can happen while maintaining good mental health. Sorry, I'm trying to change the slide, but it's a bit stuck at the moment. Yeah. Okay, so as we manage our teams and we manage our organizations, perhaps whatever initiatives we plan, big or small, what we need to think is how are we striking a good balance between connectedness between people in the era of physical distancing, a certain flexibility, but also a structure. Because as I mentioned earlier, human beings like some sort of certainty and control. So to whatever extent structures can be introduced, and we can see that even in the previous talk, all of these manuals, all of these processes, they're all attempts to provide some sort of structure and certainty to the employees so that they know what they can expect and what they need to do. However, perhaps at this time, people as the bottom line is the most important, a sense of providing a more compassionate sort of leadership. While we might value IQ a lot, I think EQ or emotional quotient, your capacity for empathy would be the most important. And the organizations that are going to lead are going to be the organizations who put people first. And people as the bottom line. So in this vein, perhaps we need to be quite sure that we have space for open dialogue in our teams. Maybe in usual circumstances, we put quite a lot of barrier between people's personal lives and their professional scope and roles. But here, perhaps some of the boundaries are blurring a little bit. We, as leaders of teams, we might need to be sure that we are asking them how they're doing. Like in the previous conversation, just a simple question about, are you okay? How are things? How are you balancing all the new challenges? I think those kind of questions we might need to ask much more frequently. And give clear information about roles and action plans within the organization. Since many of us are working online, I think there's more possibility that there can be misunderstandings because we have fewer cues and contexts. Sometimes there are drops in audio and video, and those make things difficult. At the same time, regulating our emotions and trying our best that in our organization, we provide a sense of psychological safety. Everybody has a lot of underlying worries about where work is going to go, how things are going to change. So to whatever extent, anchoring it in the here and now and providing some sense of psychological safety while checking in on people's mental health and well-being is really going to be a key for leadership in these times. So as I mentioned, maybe the key asset for all of us is going to be psychological flexibility, not just for individuals, but also for organizations. So how do you manage this in your teams? I'm going to suggest a small exercise, which is what we call a mindfulness exercise, which is something that each of us can follow when we look at uncertainties in the workplace. But also, if you are leading a team, this is something you can do along with your team members. So the first step is really to monitor and be aware of your thoughts. Because if they are worrying, anxiety-provoking thoughts, you might be sort of brushing them under the carpet and avoiding them. But it's more important to be aware of them, accept whatever difficult feelings and anxieties there are, but to prevent yourself from getting fused with your anxieties, what is also suggested, the next step is to zoom out. So step away from the difficulties, to take a little bit of perspective and look at it in a different way. And this can be a great team exercise to do as well. Finally, to understand core values. And here I think many organizations have listed out their core values and things that they work towards. So at an individual and organizational level, and then rejigging and seeing which way action can be taken at this point. Because all of us as human beings, I think we like to feel involved and engaged, and the fact that whatever we're doing is making some sort of difference. So for people to feel in this changing time, they are still relevant, they are still contributing, that kind of sense really can contribute a lot to mental health and well-being. Okay. I'm not going to dwell too much about this because I think we've addressed it in different ways today, but work-life balance is a big challenge. So rather than making very large level mental health plans, it's sometimes a very small things that can help. So even as a manager, just making sure, are you planning too many meetings? Is there some advanced information that you send for preparation so that meetings are more focused online? Are there too many notifications that you're checking all the time? So just setting aside a specific time to check, reducing pressure on yourself, on your team members for very immediate responses, making sure you're redefining the contribution and meaning of work for your team members. And of course, watching out for just this working 24/7. I think even for us at NIMHANS in the initial weeks, the days and nights were just blurring in terms of the way we were functioning. And I feel that now over time, we are still working very hard, but we've settled into a better balance where we are valuing quality over quantity. The good news is that we're already hearing that remote work can mean better productivity and less absenteeism. So let's see where this leads us in the future. Okay. So finally, I think that the important thing is to look for the unsaid. What is happening in the organization? What are the energy levels of people? Not just waiting for them to tell you verbally, but just being a lot more aware and engaged with the pulse of what is going on. Listening mindfully, asking after people's well-being, and allowing for more free expression of emotions, feelings, and thoughts, and then providing a sort of sustained response. At this time, perhaps more than ever, having an organizational culture where people feel that it's okay to reach out. It's fine to talk about emotional difficulties or mental health concerns is really critical. So whichever type of messaging formats, whichever type of initiatives at all level of the organization, here I would say it's quite organization specific, depending on the resources you have and what is possible to do. But I think every organization can do a little extra at this time. So maybe having some sessions on mindfulness or some extra wellness initiatives in whatever bits and pieces would be useful. It's also perhaps a time for teams to review the policies and processes that are already existing to support employee mental health well-being, and seeing whether these can be improved in some way. Now, some organizations may have large systems and link-ups with EAP services. For other organizations, this may not readily be possible, but at least to have a list of verified mental health resources that you can suggest to employees is critical, and this should be made available and sort of non-stigmatizing. So when I share all this, I think of a large corporate organization with which I have been engaged for a number of years now. And what I've really learned from them that it would be much easier for them to do maybe just a few, tick the box kind of sessions on, mental well-being or relaxation or time management, but they took it a step forward. And at various levels of the organization, they worked with us so that we could develop very individualized workshops for their team leads, for their managers, for HR, for security, for legal. And they really all came together. And apart from the various supportive initiatives they had, probably somewhat similar to the buddy system that was spoken about earlier, and they also introduced new policies. For example, one of the things they did is that in their insurance and medical coverage that they provide for their employees, they made it clear that getting support for mental health difficulties is just as easy and similar as for physical health difficulties. And this was really something that the employees received very, very well. So what I'm saying is that if we're really going to do something, it needs to be individualized, it needs to have buy-in at various levels of the organization and be done in a sustained way. So like I mentioned, this organization, we've now been working with them for 3-4 years. We have some outcome indicators. We also have a sense of engagement and involvement with this. So I would urge all organizations, any size, to invest in employee mental health well-being, because the benefits can be tremendous for all of you. So I'm going to wrap up now. because I know we wanted to keep a tiny bit of time for questions, but we were running late. So I'm going to stop now and hand over to Nandan.
Thank you. Thank you very much, Dr. Poornima. It was very, very insightful. Really appreciate it. And in fact, we are proud that, our Arogya Worlds program also includes the mental health and mental well-being in our assessment process for the healthy workplace. So in fact, we actually encapsulate the work-life balance criteria, which we assess how companies help employees to manage their stress in the workplace and even in the personal life and so on and so forth. So I'm sure, it's very enriching session for all the participants. Thank you very much. Please do contact us for the Healthy Workplace program if you'd like to stress or you'd like to execute in your corporate. We can certainly guide you for that. We will now open the Q&A panel for 5 minutes. And if you're not able to answer any questions, we will come back to you. So over to you, panelists, please. You can answer the questions which people will have, and we will then conclude in the next 5 to 10 minutes. So please raise your questions while we have a chat box where you can also unmute yourself and you can ask the questions. Okay, so I think there are no questions being asked by the participants. So I will quickly have one question from Dr. Kowshik. And Dr. Kowshik, if you may allow, I just want to understand how's your feedback on the journey with Arogya World on the Healthy Workplace program implemented in Toyota. If you can share your thoughts on that, it will be great.
And then, yes, I've been associated for almost now 4 years with Arogya. And I found that there are very few organizations which looks at healthy workplace as the perspective. They look at health and safety. They look at health, safety, environment as one unit. And there are a couple of agencies. Whereas I found that uniqueness with Arogya World. They specifically focus on healthy workplace as a criteria. And I'm happy with the criteria, what they have, and the way of their assessment. And the beautiful part of is the report out after your assessment to show some of the strengths and weakness. So even we reflect those weaknesses if we have, so that we can correct in the next course. So I'm quite happy with the way Arogya looks after those assessment and the healthier workplace criteria.
Thank you. Thank you, Dr. Kowshik, for your points which you have made. I'm sure it's very meaningful. But from the corporate perspective, as Dr. Poornima said, I think it's very critical that every company, whether it's large or SMEs, they should have their core value system. And I feel that the values should be ownership, accountability, sense of urgency, and respect, which plays a very, very critical role. And when you're talking about the values, actually values drives behavior, and your behavior drives action, and action drives results. I think these are very important points at this moment under the current crisis and pandemic, what we all are going through. With this note, I would like to end the session and would request Prashant and Shema to please run through the feedback survey. And we would be glad if you can share a few moments to give us the feedback, and which will help us to further enhance our knowledge sessions. So over to you, Shema, please.
Yes, thank you everybody for joining our webinar today. If you could just spend a minute filling out our feedback form, that would be great. You'll be getting a recording link and a report of this session due this week. Please look forward to it, and we hope to see you in our next webinar too.